This test consists of 3 parts: Part A, Part B, and Part C.
Part A. You will listen to 2 separate health professional patient consultations extracts. There is a total of 24 questions. For Extract 1, there are 1 to 12 questions. For Extract 2, there are 13 to 24 questions. For questions 1 to 24, complete the notes with the information you hear. At the start of each extract, you will hear a beep sound. Extract 1, questions 1 to 12. Look at the notes for Extract 1. You hear an emergency doctor talking to a patient called Penny or Offord. Complete the notes with information you hear. You have to write down a word or a phrase. You will get 30 seconds to look at the notes.
Mrs. Rawford? So, I understand you've been brought in here because you fainted at work.
That's right.
Can you tell me a bit about it?
Well, I can't really remember much. I was sitting at my desk and I suddenly got this really awful headache. My head felt like someone had fired a bullet into it. I've never had anything like it. I mean, I've had headaches before, but nothing serious. And this one was different because it was just in one place in my forehead here. And I can't remember what happened then, but my colleague sitting at the next desk, she saw me and she says I collapsed onto my desk. So she came over to help, but she says she couldn't wake me up and I was out for quite a few minutes. But I wasn't still. She says I was jerking, but I can't remember any of it. Apparently they called an ambulance and I do remember the paramedics arriving and I was able to answer some of their questions, even though I was still feeling a bit groggy. They asked me if I'd had any sort of trauma before I fainted, but I hadn't. I'd woken up as normal and cycled into work. Nothing unusual. Oh, and they also wanted to know if I'd taken any recreational drugs, but I wouldn't ever touch anything like that. I don't even drink alcohol. But they did ask me if I'd had any incontinence when I was unconscious, and I found that I'd leaked a bit of urine. I was ever so embarrassed, but they were quite okay about it. I suppose they're used to it. And once they'd got me into the ambulance, I felt really awful. I had this nausea, but they gave me something for it. It's not so bad now.
Oh, that's good. So, how's your health been generally in the past? Have you ever had anything like this before?
No, not really. I did go to the doctor a few years ago when I had some stomach pains. They did an endoscopy, but everything was normal and I've been fine since then. I'm usually quite healthy, all my family are. I've only ever had one operation, and that was a few years back now, in 2014. It was just after I'd had my 3rd child. I had to have a hysterectomy, but I've been fine since then. There was something about a year later. It must have been 2015. I'd been putting on a bit of weight and I thought it was because of the operation, but I've been feeling a bit tired as well and getting these cramps at night. The doctors did some tests because they thought I might have an underactive thyroid, but it was okay. I think maybe I'd just been overdoing it a bit.
Oh, that's excellent. Well, how do you feel now? It looks as if you've got a bit of bruising there on your face.
Yes, and I think I've got a cut there too, a little one under my eye. That must be where I fell on my desk. I've still got a bit of a headache, but nothing like as bad as it was. I do feel as if my neck's a little stiff, but that might be because I've been lying down. And the paramedics asked me lots of questions to see if I had anything funny with my vision, but...
Extract 2, questions 13 to 24. Look at the notes for Extract 2. You hear a nurse Melissa interviewing Jim Fisher, an elderly patient. Complete the notes with the information you hear. You have to write down a word or a phrase. You will get 30 seconds to look at the notes.
Firstly, let's look at the immediate needs you'll have when you go home. Now, at this hospital, we are a very good relationship with an organisation called Blue Care. Have you heard of Blue Care?
No.
Well, Blue Care is a church-based organisation which offers a variety of community services, and they aim at maximising the individual's independence and quality of life. Their staff includes nurses who can help you with some of your personal care like showering and shaving. They'll come every second day to check on your wound. What they will do is dress your wound, apply ointment, and help you with other medications.
But what about the cost? Because I'm on a pension, you know.
The good news is that these services are subsidised by the government, so there's no charge, and no one is excluded from receiving a service because of financial hardship. They also provide a range of other services, including social support, such as a chaplain for spiritual support, who can visit you if you would like that. And they also have volunteers who can call in for a chat if you want some company.
Yeah, well, I can see that would be a help.
Now let me ask you how you see your future. Do you want to continue to manage in your own home, or would you prefer to move to an aged care facility?
No, I want to stay in my own home. I'm just worried because I'm still recovering from this wound and I don't know how I'll manage to cook.
Let's just take this one step at a time. I can also arrange for an organisation called Meals on Wheels to bring in your meals.
Well, that sounds okay, but how does that work?
Well, they generally come in daily, 5 days a week. They provide one main meal per day, which is healthy and nutritious.
What about Saturday and Sunday?
Well, on Fridays, they provide extra meals for the weekend, which you can keep in the fridge. Now, for the longer term, we'll arrange for the aged care assessment team to make an appointment for a visit for you. Have you heard of this service?
No, I haven't.
The government has provided this service because they want to help and encourage you to continue to live in your own home as long as you are capable of managing.
I see.
The team, which might include a doctor, nurse, social worker, or other health professionals, come to your home and assess what your needs are and how you're managing. They assess your ability to manage on your own at home.
Well, as I said before, I'd like to stay at home. I've still got all my faculties, but I don't think my balance is all that good. So what would happen if I had a fall and no one was there?
Well, Mr. Fisher, do you have a safety rail in your shower?
No, I don't.
Well, you see, they can arrange for safety modifications like support rails in the bathroom and toilet or safety ramps where they're needed.
Well, that's good because, you know, it's a 2-storey house and I worry that I could have a fall on the steps.
Well, adequate support rails would be a consideration to make you feel safer. They can also organise a medical alert bracelet.
How does that work?
Well, this can be worn on your wrist. In an emergency, you press the button and a message is sent to the ambulance service who will respond quickly.
Yeah, well, I didn't really know there was all that help out there.
Now, I'll give you this set of brochures which tells you all about the services offered by Blue Care, Meals on Wheels and the Aged Care Assessment Team. And when you've had time to look through them, I'll call back to see if you have any more questions.
Nurse, there's just one more thing that I'd like to talk to you about.
What's that, Mr. Fisher?
Well, as I said before, my old neighbours have moved away and the neighbourhood's changed a lot. So I do feel a bit alone, you know, and over the past year there's been several house break-ins in the neighbourhood.
Well, there is one other thing I could suggest.
Oh, well, what's that?
It's another government initiative called Home Assist Secure. And if you're over 60, which of course you are, you can receive advice and help relating to home safety issues.
Oh, what can they do?
The Home Assist field staff have been trained and cleared by the police to come to your home and offer you free information and assistance.
What kind of assistance?
Well, they can help you with security lighting outside your home. They can also install windows and door locks and security screens.
Well, that sounds like a good service.
And smoke alarms are another safety device that they can install.
Part B. You will listen to 6 short workplace extracts. For each extract, you will get one multiple choice question, A, B, or C. For questions 25 to 30, choose the answer A, B, or C which fits best according to what you hear. You will get 15 seconds to read each question before you listen to the extract. At the start of each extract, you will hear a beep sound. Question 25. You hear a hospital nurse talking to a patient about oxygen therapy. You will get 15 seconds to read the question with options.
Mr. Anand, here's the oxygen mask, which we agreed would be a good idea while you're having breathing problems.
Oh, thanks.
Now, it's really easy to operate. Have you used one before?
Yeah, at home last year for a fortnight. I think I remember what to do.
Good. So you're aware of the effect on your mouth.
I'll keep drinking a little and often, because otherwise the oxygen can dry it out, can't it?
That's right. You've got to keep hydrated, so do shout out if your water jug needs refilling. Do you have any other concerns?
Well, last time the skin here, behind my ears, got quite painful and raw because of the elastic straps tight against it.
Well, if you use these little pads and loosen the straps, it'll stop that happening.
Great.
Question 26. You will hear a talk by Lucinda Burns of the National Drug and Alcohol Research Center. You will get 15 seconds to read the question with options.
So when you drink alcohol, when you drink a lot of alcohol on a quite frequent basis, we can see the fetal alcohol, which, as you say, is the facial expression of various behavioural things and shortness of the child and other abnormalities. But with cannabis, we don't see those particular visual things, but we do know that there seems to be some behavioural issues that are shown. And the issue then again is, as I mentioned previously, is it is complicated by the other things that go on in the lives of women. So, for example, if they're not eating well and they're drinking, if they might be drinking, they're smoking, it's very hard to tease out the actual effects of the cannabis.
Because I think some of the research has suggested behavioural issues, developmental issues, and if they're exposed to cannabis later on, these same children can have compound side effects from tetrahydrocannabinol. But you're arguing that they're so impure, these studies, you just can't tell.
That's exactly right, and these are exactly the same.
Question 27. You hear Roland Stalker talking about how bleach affects your heart. You will get 15 seconds to read the question with options.
Okay.
So, Norman, what we found is that the enzyme in our body that produces bleach, its name is myeloperoxidase. We've known for many years that this is present in coronary lesions that have ruptured.
So let's back up a bit. We produce bleach in our bodies.
That's right. We produce bleach as part of our immune response to kill bacteria and other pathogens.
So the way is we squirt it around our toilet, it gets squirted around our body to kill pathogens.
That's right,
too.
and we have professional enzymes that produce bleach, yeah.
Okay, and the enzyme that manufactures it, if you like, is called myeloperoxidase.
That's right, and this enzyme we have known for a long time is present in coronary arteries that have ruptured and have caused a fatal heart attack. What we haven't really been able to do is to establish a cause and effect relationship between the presence of this bleach-producing enzyme and a plaque rupture.
So what did you do?
Question 28. You hear a surgeon briefing her team about a patient they will operate on later in the day. You will get 15 seconds to read the question with options.
And the next on today's list is Freddie, who's a cloacal extrophy with a cross-fused ectopic kidney. He has a history of respiratory infections too, and there's a high risk of him getting another one following the procedure, so he'll need to be in the intensive care unit. We obviously can't start until we hear there's a place for him there, but they're calling us shortly and they sounded pretty positive this morning. This is today's main case, and I'd like to get started around midday so we can spend the whole afternoon focused on this.
Question 29. You will hear a talk on bronchial pulmonary dysplasia by Rebecca Lim. You will get 15 seconds to read the question with options.
Bronchopulmonary dysplasia.
Possibly not stem cells as a broader sense of the word, but what we think is happening is really the placenta with the amniotic sac that surrounds the baby during the course of pregnancy. We know that the human amnion has had for well over a century now amazing wound healing effects. So
really?
Oh yeah, absolutely. So
Give me
if you
an
go
example.
back. Yeah, so in 1910, it was a paper that I found trawling through. Do you remember what a library is?
No, sounds familiar. Sounds familiar.
So I remember presenting this to a group of medical students because they
Who'd never heard of a library before.
Who have never been in the university library, I don't think. So I did a little scan of this article that I found, and it was from 1910. So the use of the human amnion as a biological image. And then if you fast forward 100 years, there are still randomized control trial data out there showing that the human amnion is actually far superior to traditional bandages when it comes to wound care for third-degree burns and for skin grafts.
So what's in it? What's in the membrane?
Question 30. You hear an ophthalmic consultant giving feedback to a trainee who has just carried out an eye examination. You will get 15 seconds to read the question with options.
So, were you happy with the examination?
I think it was okay overall, but it was hard carrying out the procedures while having to deal with the patient's questions at the same time.
Yes, that can be hard. But there were lots of good things. Reassuring the patient when necessary certainly helped the process. The patient seemed rather confused sometimes about what you wanted him to do, though. That's something to work on. Think about effective ways of communicating what's required. You described in full the reasons for the various procedures, and adapting your language style to this particular patient did seem to relax him. That sort of approach puts patients at ease.
Right, thanks.
Part C. You will hear two different extracts. In each extract, you will hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer A, B, or C which fits best according to what you hear. Complete the answers as you listen to the audio. At the start of each extract, you will hear a beep sound. Now, look at the extract 1. Extract 1, questions 31 to 36. You hear a lecture based on the subject of migraine. You have 90 seconds 130 minutes to read questions 31 to 36.
The word migraine is derived from the Greek word meaning pain in half the head, as migraine often produces a unilateral or one-sided headache. It is a common and distressing disorder, and although they are not likely to take life, migraines can destroy the quality of life. Studies have shown the incidence of migraine to be in the range of 9 to 10%, and it affects 17% of the female population and 6% of the male population. So, about 2 million Australians can expect to suffer from migraine, and that translates to 1.5 million women and about 500,000 men. It is thought that more women suffer migraine than men due to hormonal factors. There are several types of migraine, the two main types being classical migraine and common migraine. Classical migraines are preceded by an aura, the duration of which varies between 15 minutes up to almost an hour. The headache usually lasts 6 to 8 hours, although they can last up to 72 hours. Common migraines are not preceded by an aura, and the headache lasts between 4 and 72 hours and can be pulsating and unilateral. And upset and vomiting are common symptoms. Migraines can be divided into a number of distinct phases. The first phase includes the early warning symptoms. A significant number of migraine sufferers experience warning symptoms for up to 24 hours before the attacks start, but may have these signs unless they know what to look for. The common symptoms include changes in mood, and these moods can vary from elation, such as feeling on top of the world and full of energy, to opposite moods, such as feeling depressed and irritable. There are several abdominal symptoms common to migraine, including nausea, changes in appetite, such as intense hunger or sugar craving, constipation, and diarrhea. Neurological changes may also occur prior to the migraine, including drowsiness, incessant symptoms of dysphagia, such as difficulty in finding the right words, a reaction to excessive brightness or sound, and difficulty in eye focus. There may also be changes in behavior, such as hyperactivity, clumsiness, or lethargy. And many sufferers report muscular symptoms, such as general aches and pains. The second phase is the aura. The aura accompanies migraine attacks in about 20 to 30% of migraine sufferers. The most common aura symptoms are visual disturbances, such as bright, zig and flashing lights. As well as that, there may be difficulty in focusing or blind spots. The aura commonly affects only one eye, but it can disturb the visual field of both eyes. It usually lasts between 5 and 60 minutes, then the vision normally returns to normal. Less commonly, aura affects sensation or speech. The third phase is the headache. The headache phase can last for up to 3 days. It is often throbbing and on one side of the head, but it can affect both, and it is made worse by any kind of movement. The most common accompanying symptoms in this phase are sensitivity to light, sound, and smell. Eating can help reduce symptoms, especially starchy foods such as breads and pastas. The symptoms can be more distressing than the headache itself. The final recovery stage may last for about 24 hours, and feelings range from complete lethargy to feelings of high energy and even euphoria. Sleep often is beneficial for adults, while effective medication can improve attacks for chronic sufferers. Children seem to feel much better after vomiting, and for a few, nothing works except the headache burning itself out. The dietary triggers include alcohol, especially red wine, certain types of food, notably aged cheese or chocolate, withdrawal from caffeine or caffeinated drinks such as coffee and tea, the food additive monosodium glutamate, dehydration, and inadequate meals. Environmental triggers include bright sunlight, flickering lights, strong smells, for example, perfume, gasoline, chemicals, smoke-filled rooms, and certain food odors. Another environmental trigger is high altitudes or flying. Weather changes can be a trigger factor, or overuse or incorrect use of computers. Other trigger factors include the hormonal triggers. Hormonal fluctuations are implicated as a significant trigger for women, as 3 times as many women suffer from migraine headaches as men. This difference being most apparent during the reproductive years. The hormonal triggers may be menstruation, and a UK study found that 50% of women are more likely to have migraine around menstruation, ovulation, use of oral contraceptives, pregnancy, and it may be worse for the first few months, but in 2/3 of women it improves in the latter part.
Extract 2, questions 37 to 42. You hear an interview with Dr. Christine, who's talking about a research supporting non-fasting lipid blood tests for cholesterol. You have 90 seconds 130 minutes to read questions 37 to 42.
Hello and welcome to Health Research Roundup. For decades, people have been asked to fast before they have blood tests to check cholesterol levels. However, a new research report from an international group of experts suggests that this is not necessary. To discuss this research, my guest today is Christine Eriksson from Copenhagen University Hospital, who was a lead author of the study. Christine, welcome.
Thank you very much.
So why did we ever ask people to fast for blood lipids, for your blood fats?
Well, if you ask me, I don't really know, except for that's what we've been doing for so many years. I really tried to read the literature and find some very scientific evidence supporting that it is superior to just taking a random non-fasting blood sample as we do now. And I had problems finding the evidence. There's a lot of arguments people put forward for why you should use fasting versus non-fasting, but really solid evidence that is better, I can't find it.
So was this a tradition rather than science?
I think so, yes. I mean, you can ask me why did it start? I think that some of the early studies, the original publications way back, said that they used fasting samples and therefore everybody thought you had to do that without really thinking why. But those doctors may have had good reason to do it that way, but there's nothing I've seen that said it had to be done that way. And there's all this evidence now from Canada and the US, 2 excellent studies, one in children and one in adults. And then we have a lot of studies from Copenhagen, and they all show that when you just look at people that eat and drink whatever they usually do, and you take a lipid panel, cholesterol, triglycerides, a very common fat in the blood, then they don't really change very much in response to when you have been eating.
So there is a difference?
Yeah, the difference is in millimoles per litre. So it goes up by about 0.3 millimoles per litre. However, in clinical practice, you look at triglycerides, you're interested in whether it increases 1 or 2 millimoles, not 0.3 millimoles. So that's what's clinically relevant.
And even with a bad form of cholesterol, that's not going to make the difference between whether or not they put you on medication?
Yeah, that's right. We provide data in this report where we did direct measurement and after fasting and in about 6,000 people, and the correlation between the two methods was, I can't see the difference. It looks exactly the same.
So you moved over in Denmark to this official recommendation about 7 years ago. So what's happened since then? Have there been any issues because of undiagnosed cholesterol levels?
No, everybody was happy right away. Even the laboratories that didn't change right away, they were pushed by patients because there were reports in the media telling them that at Copenhagen University Hospital, we're doing non-fasting, so everyone wanted to do it. And I can say today, patients, clinicians, laboratories, everyone's happy. Everyone likes it because it's so much simpler.
And patients like it because they can go when it suits them to the pathologist, so they're more likely to turn up for their blood tests?
Yes, of course. I don't have fantastic good numbers for you, but certainly you hear from so many colleagues that people don't go to have their lipid test because it's so complicated to fast. And then they have to go to work to have an important meeting, and they can't do this in the morning. But now, doing a random non-fasting, you can come whenever it suits you.
And very briefly, is there any circumstance where you should have a fasting blood fat level done?
Well, this recommendation, it's 21 world experts, many from Europe, the US, and one from Australia also. And of course, when you have so many experts, there's always someone that thinks there's certain situations. We list a few where you can do. For example, for patients with diabetes, the fasting requirements might be an important safety issue because of problems with hypoglycemia. But if you ask me, way down in my heart, is it necessary? I don't really